You can't sleep because you have neck pain and or a pinched nerve. What do you do? In this video, I'm going to show you the best ways to sleep comfortably, whether you have neck pain, a pinched nerve, or both. Stay tuned. My name is Dr. Jon Saunders. I've been in clinical practice for 21 years, treating patients with spinal-related conditions. In this video, I'm going to discuss how you can sleep comfortably if you have a pinched nerve in your neck that just won't let you fall asleep at night. I know it can be frustrating and prevent you from getting a good night's sleep. There are ways that will allow you to get comfortable so you can get the sleep necessary to allow your body to heal. If you're suffering from a pinched nerve in your neck, you know it can be downright frustrating. Further, it can prevent you from falling asleep and getting a comfortable night's sleep, which is imperative to your body's ability to heal. One important thing you need to consider when trying to sleep with a pinched nerve or neck pain is you need to consider what normal alignment is. When we look at the spine from the front, we expect and hope to see that it's nice and straight. So we need to consider that when choosing a pillow or the position we sleep in. Most important for a pinched nerve, often caused by a disc bulge or herniation, a bone spur, or tight muscles, we really want to make sure we're trying to support that natural curve or arc in our neck. This position is the best position to keep the tissues in a relaxed state, meaning when your spine is in the right alignment, it's in its most stable position, which allows pressure to be evenly distributed normally through disc tissue, nerve tissue, ligaments, and muscles. So we really want to make sure we're trying to maintain proper alignment and posture in the positions we sleep. Let's get right to it. I'm going to show you the two best positions you can sleep if you're suffering from neck pain or pinched nerve to help you get the best sleep you've had in weeks. So let's start on our back. We want to get in a position that's going to support the natural curve in our neck. So a few pillows might do a better job at this. First and foremost, we've all seen these curved pillows. One has a thin and one has a thicker side. When you're on your back, typically want to use the thin or the smaller side to help support that natural curve where the head sits in this little cutout. One of the biggest things to understand is your pillows are for your neck, not your head. So when you have a pillow that supports your neck in a proper alignment, it's going to take pressure off the discs and nerves, something that's going to give you some relief at night. Another pillow you could use would be a roll pillow. They're quite popular as well. The same thing, you're going to put the pillow in the middle of the neck to help support that curve. Now, because the spine is attached from top to bottom, we want to consider what's happening in our lower back as well. So what I'm going to do is I'm going to demonstrate a very simple way to get in position where we're using the best pillow to help support the curve in our neck. You should always start with a pillow underneath your knees to help support your pelvis posture as well as your lower back. Because your lower back's attached to your mid back, which is attached to your neck, it's really important to look at the whole spine, and your posture should be considered when, even though video is for relieving pressure in your neck for a pinched nerve, we want to keep everything else in alignment as well. So you can see that we're really focusing on supporting the natural curve. If the pillow is on your head, you can see that that would do the opposite effect, is something that would make the problem worse. So you really want to make sure your neck is supported in the right position. And again, you can use a curved pillow, you can use a roll pillow, you can even use a normal pillow, which let me show you here. Let's just change these around. I think the biggest thing when you use a regular pillow like this is that the edge of the pillow needs to be between your shoulder blades. So let me show you what you shouldn't do. You wouldn't want to have a pillow and focus on the head, because what it's doing is taking that curve and straightening it, or worse, putting it in the opposite direction, which can really stress the cervical nerves. What you want to do is you want to bring the pillow a little bit further down. And the most important thing here is making sure your head is in line with your shoulder, which is in line with your thoracic spine. Keeping it nice and straight so that you're supporting a good posture to help alleviate any tension that's going through the spinal nerves that's causing that searing pain from the neck down the arm. Now, if you're like most people, you're probably not going to stay in the same position, and that's okay. The next position we're going to demonstrate is the side position. I'm going to show you a couple important things that you need to avoid in order to help take tension off the spinal nerve that's causing that radiating pain, or the neck pain that's causing the radiation between your shoulder blades. So let's get to that. So let's get to side sleeping. When you're side sleeping, we want to make sure the affected side, so if the neck pain is on the right, for example, and the pain's going down your right arm or in between your right shoulder blade, what you want to do is to have that side up. So we want the unaffected side down. Now for this pillow, this is where we want to change the pillow around to have the thicker side to support the distance between the tip of our shoulder and our ear, to make sure that when we're lying down that our head is perpendicular to our shoulders. And so that simply looks like this. We're going to slide the pillow in to support the neck and come down. The unaffected arm, this is where it gets tricky. For some people, the arm up will take tension out of the nerve, and that will be the position you want it in. For others, you might find it needs to be on your side, or you'd put a pillow in this small part here in front of your stomach to help support the arm too. And so there's a variety of ways that you need to experiment with the arm, but the biggest thing is making sure your head is in line with your shoulders and your thoracic cage, and that you have some support for your arm in the right position to keep tension out of those spinal nerves. You can see if the pillow was too thin, your head would be in a position that would be creating more tension in those nerves. And if it's too fat, the same thing, you're going to compress the nerves on the affected right side. So you want something. And again, this can be a cervical pillow like this. It can be a regular pillow. It can be a rolled pillow between our legs. And you're going to just want to support that. One thing you don't want to do is to make sure your head is not slipping down into the fetal position. Again, that's going to take the natural curve out of our neck, something we're trying to preserve while we sleep. And then you're going to, again, manipulate the arm with a pillow here or here. That's going to get you the best relief based on how much tension you can reduce in those nerve roots. Now that I've shown you the two best ways to sleep with a pinched nerve in your neck, I want to switch gears briefly just to give you two excellent stretches or traction stretches you can try either before you go to bed or when you first wake up. Now, one or two of these may be irritating to the condition, so you really want to test this out. The first one's simple. You're going to lie to the edge of your bed, arms to your side, and just let your head slowly hang. You're going to relax into this stretch up to 30 to 60 seconds. Just visualize your head tractioning off your upper back to get the full effect. You can do that one or two times, either right before you go to bed or when you first wake up. Now, for some of you, that's going to irritate it. So you want to try the opposite traction. And so this, we're going to flip over, lie on our back, come to the edge of your bed, and again, slowly let your head hang. And then just relax into it. You can hold this one for 30 to 60 seconds again. And really feel that your head is being pulled from the top of your upper back to get the full effect of the traction. And remember, if you want more specific and efficient help with your problem, it's always best to seek out local professional help. Try those sleep positions tonight and let me know how it goes. As well, which of those tractions did you find more helpful? Put in the comments below and let me know which one you like the best. If you like videos like this, maybe you'll show some support by giving me a thumbs up. And if you're new to my channel, maybe you'll consider subscribing by hitting the subscribe button below and the notification bell so you can be informed when I upload a new video. If you're suffering with neck pain or pinched nerve, I get it, I understand. It is frustrating. Stick around and check out some of my videos. I'm sure you're gonna find one that's helpful for you to give you quick relief so you can get back to living your life without any limitations. I appreciate you tuning in. I can't wait to see you in my next video. Until then, stay well.